I'm Catherine Rosero Mindiola. My topic is Multicenter trial of a combined probiotic for children with gastroenteritis. Definitions. Gastroenteritis is an infection or inflammation of the lining intestinal mucosa of the stomach and small intestine, which can be caused by infectious agents, viruses, bacteria, parasites, toxins, chemicals, and drugs, with symptoms such as abdominal pain, vomiting, diarrhea, sometimes fever and headache. In the most developed countries, the morbidity number of people who fall in a certain place and period of time in relation to the general population. Due to this, stomach virus is close to 38 million cows per year. It is associated with a mortality of 325 to 425 causes per year, and it is a frequent cause of hospitalization in the pediatric populations. 9% of children under 5 years of age.
So gastroenteritis is kind of a big word, but I think like all big words, the best way to really understand it is by breaking it down. So gastro refers to stomach, enter refers to small intestine, and itis refers to inflammation. So there are really two different types of gastroenteritis. There's acute gastroenteritis, and there's chronic gastroenteritis. Acute gastroenteritis doesn't last very long. It's usually about a few days to a week. Chronic gastroenteritis, on the other hand, is persistent. It lasts for a pretty long period of time. We're going to mostly be talking about acute gastroenteritis. So when people have acute gastroenteritis, they don't usually say, like, I have acute gastroenteritis. They usually say something like, I have the stomach flu, or the stomach bug, or a stomach virus. So anyone who said they've had this is kind of familiar with some of the symptoms associated with it. So to look at those symptoms, why don't we actually look at the gastrointestinal tract over here. So here is the stomach, and here is the small intestine in green. So after you consume a meal, you'll have some stuff in your stomach that your digestive system is really trying to digest and then absorb. But when you have gastroenteritis, your digestive tract can't do that. So now you have all this stuff that your body is going to want to expel. So how is it going to do that? Well, it can either come out this way, right, through your esophagus, and that's really why you experience some vomiting and nausea. It can also come out from the other end as well, right? And that's why a lot of people may experience some diarrhea. So there's a lot of nutrients and a lot of water that you've consumed, but your body isn't taking it. Now, because you're vomiting and excreting a lot of water out, you're not getting that water into your system. So you'll be pretty badly dehydrated as well. Some other symptoms could include things like abdominal pain and a fever. And usually in acute gastroenteritis, these symptoms last for about a few days to at most a week. So what's causing all of these symptoms to occur? What causes gastroenteritis? Well, sometimes people call it the stomach flu, and I think that can be a bit misleading. The ordinary flu is caused by the influenza virus. But this virus has absolutely nothing to do with gastroenteritis. There are a number of different infectious pathogens that can cause this instead. So you may have some different viruses or some different bacteria. So a few examples, right, some really common examples of the many different pathogens would be, like the rotavirus, the norovirus. So these are examples of viruses that could cause the disease. An example of a bacteria would be something called enterotoxigenic E. coli. Right, so this is just a really fancy name for some bacteria that could cause the disease. But all in all, there are a lot of other types of pathogens that could cause it as well. So how do these pathogens get into your system to begin with? It's usually through fecal to oral transmission. So your feces is the stuff that gets undigested and doesn't get absorbed into your system and gets excreted as waste. That feces can contain the pathogen, so it's contaminated. And oral just refers to someone's mouth. So maybe someone with gastroenteritis uses the bathroom and they wash their hands, but not well enough. So their hands might actually be contaminated with some of the pathogen. And then they may go on to touch other objects, right? Surfaces and foods and water that you may touch. And then if you touch those with your hands, or if you eat the contaminated food or water, then you can give the pathogen very easy access to your own gastrointestinal system. So once it's in your system, what is it going to do? So going back to our diagram over here, you have this wall that really kind of extends over the entire gastrointestinal tract, your stomach and your small intestine and so on and so forth. So we call this wall or this lining the gastrointestinal wall. And this is what we're going to be focusing on. So let's actually zoom in on that a bit. So here I kind of have a zoomed in picture of that. And I want to mostly focus on this green structure over here. This green structure is just the epithelium. It contains all of the cells that will be specialized for digestion and absorption. So maybe you eat some food over here, right, that's being partially digested. But in the food that you ate, maybe there was some of the pathogen. The pathogen is then going to invade the epithelium. So it's going to invade those cells, and those cells are going to die off. These epithelial cells are going to kind of slough off of the lining over here. So maybe you'll have some dead epithelial cells in the partially digested food that you're trying to eat. So now you don't have those epithelial cells to digest and absorb food and water. So you're going to actually have a lot of water here. And instead of going into your system, it's just going to stay here. Right? So now you can't digest some of the foods, that may lead to some vomiting. And because this has so much water in it, it's going to come out as diarrhea. So the water is really staying here, it's not getting into your system, and therefore you also have dehydration. And there's actually some more stuff in here as well. Remember that the itis in gastroenteritis refers to inflammation. That basically just means that the immune system is here. So the immune system may be around this gastrointestinal wall. So you have a whole bunch of white blood cells over here as well. And then maybe they'll find their way into this little mixture over here as well. So you have a lot of stuff in here that you really don't want to be in here. And you're not getting that stuff into your system. You're just expelling it out because the pathogen has destroyed the epithelium. So maybe you're displaying all of these symptoms and you think you may have gastroenteritis. So you go to the doctor and you really want to confirm this. So the doctor may conclude that you have gastroenteritis, right, based off of the symptoms alone. But they may actually do a few more tests, right, just to verify a few things. So maybe you want to find out what pathogen exactly is in your system. That way you can know what treatment options you can take. So what the doctor can do is they can order a stool sample. They can then send this sample off to a lab to evaluate what exactly is in there. Because remember, your feces is going to be contaminated with the pathogen. For example, it could be the norovirus. It could be that enterotoxigenic E. coli. Maybe it's that rotavirus that I talked about earlier. Or maybe it's something else. But this is really just to verify what's in there. They can also have a blood test done. So they may actually send this off to a lab, right, to evaluate the blood. When you look at the blood, you're not actually looking for the virus. You're looking for signs that the person may have some dehydration. That would include high levels of sodium and creatinine. If these exist in high levels, then there's a pretty good chance that the person is dehydrated. So you've confirmed that the person has gastroenteritis. So how can we treat that? We can put the person on oral rehydration therapy. This is really just a fancy way of getting the person to drink a lot of fluids. So drinking a lot of water, drinking fluids that contain a lot of sugars and salt and all that stuff, because the person is pretty badly dehydrated. They really need to get some water. If it's getting pretty severe, you can actually have the person be put on an IV fluid. So sometimes people are given antibiotics. This can be helpful if it's being caused by a bacteria, because antibiotics target bacteria. But if it's targeting a virus, then these won't really be helpful, because antibiotics do not target viruses. It's also important to be aware of the fact that you have a lot of good bacteria in your gastrointestinal system that help digest and absorb food. So these antibiotics could potentially damage those bacteria as well. So whether or not you give someone antibiotics, it really depends on the nature of the pathogen and the individual. So there isn't really a medicine to kind of treat gastroenteritis or cure gastroenteritis. It kind of goes away on its own after about a week or so. But how can we prevent it so that we don't have to treat it to begin with? The absolute best thing to do is to just practice good hygiene. So whether or not you have gastroenteritis, it's always a good idea to really thoroughly wash your hands after using the bathroom. You should also take care to drink water that's definitely decontaminated and clean. And you should also make sure to cook your food really well, just to be sure that it isn't contaminated with the pathogen so that anyone who eats it could get gastroenteritis.
Application in medicine. Since gastroenteritis is easily transmitted from person to person, it is advisable to take extreme precautions, especially frequent hand washings by those affected and those around them. There are vaccines against rotavirus, the main virus that causes gastroenteritis in children, which are administered as a drink. It is also advisable to take precautions when consuming food that may be contaminated with salmonella, such as products made with rat eggs.
So you're starving after a day at work and pull out some pasta from the fridge. You can't quite remember how long it's been there, but it looks pretty good. You warm it up in the microwave and gobble it down. It's a bit cold in the middle, but who cares, right? Unfortunately, your gut cares. A few hours later, you're running back and forth from the toilet with loose, watery diarrhea. On one of your many trips to the toilet, you start to wonder, is the diarrhea actually helping you clear the infection? And do you need medications to try and stop it? Let's take a closer look at what causes diarrhea in the first place and what you can do to recover as quickly as possible. The timing of diarrhea can give an important clue about the cause. Diarrhea that develops within 24 hours of eating something dodgy is most likely going to be caused by an infection. Diarrhea can be caused by viruses like norovirus or rotavirus, bacteria like Salmonella and Campylobacter, or one-celled organisms called protozoa. Of the three, a viral infection is the most common cause of diarrhea. Diarrhea develops because these infections either infiltrate the lining of the intestine or release a toxin. Whichever method of attack, the result is the same. The lining of the intestines becomes inflamed, and your body tries to flush out the infection by secreting mucus and fluid. This is what you experience as diarrhea. Loose and watery stools that you need to pass every few hours. Most cases of diarrhea will settle down within 4 to 7 days, once the immune system has cleared the infection and the inflammation has resolved. So in one way, diarrhea is good because it helps remove the infection and any potential toxins. But there is a downside. Diarrhea makes you lose not only water, but also other electrolytes like salt and potassium. Drinking water alone is not enough to replace these electrolytes. So try to drink fluids that are a mixture of water, salt, and sugar. For mild diarrhea, fruit juices or sports drinks are usually enough to meet your fluid and salt needs. You can even make your own electrolyte replacement drinks at home with 500 ml of water mixed with half a teaspoon of salt, 2 to 4 tablespoons of sugar or honey, and something for flavoring like 250 ml of orange juice. For more severe diarrhea, you may need to buy oral rehydration solutions to get enough electrolytes back into your body. In terms of your diet, you should only eat as much as your body can tolerate. If you have severe nausea or vomiting, then a short period of drinking fluids only will not harm you. When you're feeling up to it, you can introduce starchy foods like rice, noodles, or potatoes. Other good options are soups, fruits like bananas, and boiled vegetables. It's a good idea to avoid high-fat foods because these can be difficult to digest. Also, it's common to get a brief period of lactose intolerance after a gut infection, so temporarily avoiding dairy can also be helpful. What about anti-diarrhea medications? These can be bought over the counter and can be helpful for controlling the frequency of motions for a short period of time. They work quite well but aren't recommended for continuous use because they can prevent the excretion of the infection and may lead to pooling of fluid in the gut. What about probiotics? Well, these aren't essential, but they can help in reducing the duration of diarrhea. One study showed that taking probiotics reduced the duration of diarrhea by an average of 25 hours. So if you'd like to shorten your illness as much as possible, probiotics may be helpful. The two most commonly studied probiotics are Lactobacillus GG and S. boulardii. So look for these on the label when you go to the pharmacy. Since diarrhea caused by an infection usually goes away on its own, antibiotics are not used routinely. Some drawbacks of using antibiotics include unwanted side effects, the potential for bacterial resistance, and killing off healthy gut bacteria. There are some situations where you may benefit from seeing a doctor. If you have bloody diarrhea or large volume diarrhea, severe abdominal pain and fever, severe nausea and vomiting that prevents you from drinking, if diarrhea lasts for more than 1 week, or if you're elderly or have other medical conditions that would delay recovery from an infection. Your doctor will consider whether antibiotics or even intravenous fluids may help you. So diarrhea isn't fun.
Cons. Pros. Protect your body, help balance your intestinal flora, restore intestinal flora, relieves colic, dairy tolerance, stomach infections. Cons. Data is lacking to determine whether the use of probiotics improved results in their children. It also did not shorten the duration of gastroenteritis.
What are probiotics? Probiotics are microorganisms or good live bacteria that are beneficial to your health, especially your digestive system. In our body's intestinal tract, bacteria, also known as gut flora, live. They are beneficial to the body in many ways. As part of their metabolism, they produce vitamins B and K. They stimulate enzymes that break down certain food components. They help reduce the amount of feces, and they help the immune system by promoting the formation of antibodies. In fact, the weight of excreted fecal matter is comprised of at least 1/3 of these bacteria. Many foods that go through a fermentation process contain natural probiotics. Fermentation is a process where food is exposed to bacteria. Some of these foods include yogurt, some aged cheeses such as Gouda, mozzarella, cheddar, and cottage cheese, sauerkraut, tempeh, which is a fermented soybean product, and kombucha, which is a black or green tea drink. Probiotics are also sold as a dietary supplement, which contains strains of these microorganisms. Some of the benefits associated with probiotics include reducing diarrhea, especially antibiotic-associated diarrhea. They may help enhance immune responses, treating irritable bowel syndrome, and they can help overall digestive function. It's believed that probiotics may also lower blood pressure. They can be beneficial to dental health, help with some skin conditions, improve vaginal health, and may be beneficial for brain function in easing anxiety and depression. More scientific research needs to be done to truly validate all of these possible health benefits associated with probiotics. And that be the wonderful world.
Issue applied in Ecuador. We conducted a randomized double-blind trial that included 886 children 3 to 48 months of age with gastroenteritis. The primary outcome was moderate to severe gastroenteritis, which was defined according to the modified Versailles scale symptom score after enrollment of 9 or higher. Scores range from 0 to 20, and higher score indicate more serious disease. Secondary outcomes included the duration of diarrhea and vomiting, the percent of children who has in scheduled medical visit, and the presence of absence of adverse events. Conclusion. Treatment with combined probiotics is not a solution to childhood gastroenteritis problems, but it does help to counteract certain symptoms of disease. Probiotics are a fundamental part for the restoration of the stomach and intestinal mucosa and thus observe improvement.